You have seen a lot of different arrangements. You've worked with several office managers.
Yep.
Are there things that we should know that maybe we don't know that's going on in the mind of a dentist? What is it that you wish we understood?
That the scariest conversations that we have are probably with upset employees and not upset patients.
Interesting.
And I hear it from dentists all the time that stresses them out more to have to manage team issues than an upset patient. And obviously all of this stems from miscommunication, but I would say that actively is something that stresses most doctors out, stresses me out. And so having that partner, and again, that partner that's been given job duties and is allowed to do his or her job without being micromanaged, because like guilty, right? A lot of us do that, is so key. But yeah, definitely. I would rather talk to a patient that was mad than a team member that was mad any day.
Well, we don't go away. We're there all day. So that's another thing. Yeah. Yep. And I know assistants always like having your assistant mad at you is awful, because I can imagine like Jean and I, the girl who took over my position, we worked right next to each other. If we were not happy with each other all day, it was a terrible day for everyone. So I can just imagine operatory setting. I'm sure the patients can feel that like vibrating off of you guys.
Yeah, exactly. So I would say that that's probably the first thing that popped into my head.
Would you rather that we take a little bit more initiative and start to do more HR stuff? I mean, how would you handle it? What if you've got somebody who is really good but doesn't want to overstep? Because that is a problem, right? Like when a manager tries to put in place policies, guidelines, whatever, maybe they discipline a team member and then the doctor doesn't back them up. Then the manager's like, I'm never doing that again. So if you were in that kind of manager newness growing into something bigger, what would you do in that situation?
Well, first of all, I would ask the doctor what the expectations are in the form of very defined job duties, right? Because if you don't have job duties and you don't know what you're supposed to be doing, then it's always going to feel like you're overstepping, right? If it's not all kind of written down. That's the first thing. And the second thing is that you need to have a conversation about, okay, how do you want me to handle drama in the office? Do you want there to be scheduled time at the end of the day? Is it something that I should be pulling people aside right away? Do you want me to run it by you first? There's some doctors that are like, do whatever you want, right? We sign off on it.
Right.
And there's other doctors that are like, I want to know. And so I think when the wires get crossed is when you've got someone that wants to be hands off and someone that wants to know, and then the expectations weren't laid out.
Yeah, I definitely feel like I know I talk to lots of managers who want to have that wonderful relationship, to be like the second, like the real person who is really like the engine behind everything. And I see that more often than I don't. I hear from doctors all the time, I wish I could find someone who was looking out for the office, have ownership mentality. And I feel like there's a lot of us that have ownership mentality without being an owner. You know, maybe we're just in the wrong place. I mean, maybe they're just not in an office that can make a difference right now. But I feel like there's room in offices for somebody to have real ownership mentality and not overstep.
Yeah. And I think that it's definitely about finding that right balance and that right environment for you. Look, us dentists are guilty of thinking we can do everything. We very clearly cannot. Cannot.
Yeah.
But I think you're right. Those offices do exist where you can feel empowered and like you are making a difference, and also kind of working hand in hand with the doctor, but then also with the team members. Being busy and being productive are two different things, right? I don't want to be busy all day because I'm not trying to do everything. I want to empower my team with specific job duties and tasks, and then have my business team manager oversee all of that. And then I want to work in tandem with him or her.
So speaking of being busy and not productive, let's go back to benefits, because I feel like that's the number one thing I hear dentists saying is they're always on the phone. I'm paying for all these services. Are they actually using the services? Like they feel like there's no ROI from the spend that they're making, because really it's ROI to just maintain your income. It's not like when you buy a piece of equipment, you're supposed to, like your income's supposed to get bigger, but because you're doing more. But with insurance software, you're spending money just to make sure you're recapturing the same amount of money. There's no growth.
Exactly.
So, and then doctors see this labor spend as totally an expense. There's no profitability there. One doctor said, at least my hygienist generates revenue. And I was like, okay, that we're totally looking at this differently. Can't argue with that, but we're looking at this differently.
Right.
So as a dentist, are you hearing that they're upset about labor? Are they upset about the complexity? Like what is frustrating them the most about the whole benefits thing?
The ever-changing rules, sometimes with no notice, and the fact that it feels like we're getting squeezed every way, right? You've got the people that are coming out with huge student loans. You've got the practice owners, even if they're not new, that have huge practice debt. They've got to keep their lights on, and reimbursements are stagnant largely. So they just feel like, and then they have to pay out in order to chase that stagnant or decreasing amount of dollars and cents.
Yeah.
That would be that's the biggest issue I hear.
Yeah, definitely. It feels, they're like, I have to spend money in order to make money, and it's not in a good way. Would you like to hear more? Follow the link for the full episode.